Welcome everyone. Our objective at Mölnlycke is to move burn care forward, and today we will discuss standard of care in burns, and more particularly the key findings of a publication entitled Global Burn Care and the Ideal Burn Dressing, a survey of global experts. And today we have the privilege to welcome Professor Kamolz. You're one of the authors of the publication.
Thanks for inviting me.
So as a reminder, you're running the Department of Surgery in Graz, Austria, and you're also the director of the Burn Center and the Research Center for Regenerative and Personalized Medicine. So really, we are really pleased to have you here today. To start this interview, could you please tell us a bit more about the objective, methodology, and the respondents of this survey?
So the aim of that study was more or less to get a more profound overview about the special needs. How should be the ideal burn dressing should be designed. So this was more or less the objective. And what we have noticed during the first studies was that we had some blind spots. For example, in Africa, we only had some participants. So we decided, okay, we will redo it and we want to enlarge it. So we did some modification on the survey, and then we have translated the survey from English also into Spanish, French, Chinese, and so forth, to get a more profound overview about the special needs. So that was the main reason why we decided to redo it and to make a reloaded version of that survey.
And how many respondents did you get?
So we got respondents about 200 from 49 countries. So I think we have a pretty good overview about the special needs and if there are some differences between different countries and different continents.
And the respondents were, which specialty?
So the respondents were mainly surgeons, anesthetists, but also nurses. So all experts which are more or less working in the burn field. So we have sent it out to more than 1,000 experts, and we got the feedback back from 200.
Okay, so you just mentioned that this survey was not the first one of its kind. So have you seen any changes or evolutions in burn care and particularly in the ideal burn dressing throughout your career?
So we have done the first one, we've done it in 2012, and then we have done up till now more or less three versions. And what we have found out that we saw some slightly changes, but especially what we found out is that there is a special need for more advanced dressings. So we have the tendency that we don't want to use silver sulfadiazine anymore. We don't want to perform daily dressing changes. So we really have the feeling that there is the tendency to go for more advanced dressing materials. And this was more or less the most obvious observation in the last questionnaire. There is a need for more advanced therapies and advanced dressing materials.
Okay. And now I'm very curious to hear from you, what are from this survey the characteristics that the respondent judged as very important for their practice?
So if we're talking about the ideal burn dressing, so number one more or less is always anti-infectiveness. So that factor is playing a major role if we're talking about burns. The other more or less aspects are everything which is dealing more or less with pain and reduction of pain during dressing changes and so on and so forth. So there's a group of factors which have more or less a direct or indirect influence on pain. The other one is, for example, absorbency. If it can more or less reduce burn wound progression by cooling down the wound in the early phase, bulkiness, and so on and so forth. So we have asked several topics, and the ranking was more or less that the most important ones are still, as I've mentioned, anti-infectiveness, pain, absorbency, and so forth.
So anti-infective properties, you mentioned, is ranked as number one in this ranking. But it's interesting that only 60% of the respondents would say that it's an important or very important parameter. So how can we explain this difference?
if we're talking about burns, anti-infectiveness is of course very, very important. But this is getting, the more deep the burn wound gets, the more important it gets, because fast healing wounds, they have not such a high risk of infection. But if we're talking about superficial and deep dermal burns, anti-infectiveness is getting more and more important. And this is also seen, for example, if you compare it to other wounds. If you compare it to donor site wounds, where the majority of the experts are of the opinion that there's not such a high risk of infection, if you're asking them about the properties of the ideal donor site dressing, they will tell you anti-infectiveness is not so important. So you can see that, for example, anti-infectiveness is important in that field, but probably not in this wound field.
Okay. And now if we're talking about burns, so this is very important, as you mentioned, and probably it's not so surprising knowing that burns are linked with a high risk of infection that could potentially lead to death in some cases. What other risks could we see linked with infection?
So we did several publications about that topic, more or less, infection, inflammation, and so forth. And we were able to demonstrate if you have a prolonged inflammatory phase, this will lead to prolonged wound healing. And you know, prolonged wound healing is also a risk factor for developing hypertrophic scars. And in the other experiment, we were able to demonstrate that the burn wound by itself has a higher risk to develop scarring than, for example, a normal surgical wound. And the highest risk of developing hypertrophic scarring is if you have a burn wound which gets infected and you have an inflammation or a prolonged inflammation. So that's one of the reasons why we think also that anti-infectiveness is not only important to keep the inflammatory phase short, but is to promote wound healing and to reduce the risk of finally of developing hypertrophic scars.
Okay, so that's very, very interesting. And coming back to what you mentioned a bit earlier, you mentioned parameters linked with the pain management. So in this survey, we see that pain reduction, lack of adhesion to wound bed, and free dressing change are ranked as in the top also. How can we explain that? Why does pain management play such an important role in burn care?
I think all of us once in a lifetime had or will have a burn wound. And the most thing everyone knows is that burn hurts. And the other thing is burn does not only hurt, it means stress. And we all know that pain and stress is not good for wound healing. There's some good publications, some recent publications, which were able to demonstrate that there is a direct link between pain, stress, and wound healing time, that this can lead to delayed wound healing. And the other thing, which is more or less very important, also if we are talking about not about the smaller ones, but about the bigger burns, is that we should get the patient out of the bed, because laying in bed, you have a high risk for pulmonary infection, pulmonary disease, lung infection, and so on and so forth. So it's very important to get the patient out of the bed quite early. And we all know if we need, for the dressing changes, due to the pain, we need pain medication or sedation, that more or less during these phases, the patient cannot be mobilized. So that's the main reason why why we have so many factors who have a direct influence on the pain and on wound healing is, for example, the number of dressing changes, because if you can reduce the number of dressing changes, you can reduce the need for pain medication, but also for sedation. So you can the patient can be more mobilized. But on the other side, you know that if the patient, or not the patient, the dressing is sticking onto the wound and you have to remove it, it means pain. So there are so many factors which have more or less, if we're talking about the ideal burn dressing, which have a direct or indirect influence on the pain level, and thereby more or less also on the outcome.
Okay, thank you. And you just mentioned like reducing the frequency of dressing changes. could that also be linked with cost effectiveness? How nowadays is cost effectiveness integrated as part of the characteristic for ideal burn dressing?
So I think because the overall costs are increasing worldwide, not only in the high income countries, also in middle and low income countries, the overall costs are increasing. This factor is very important. But I think in future, we will not talk about the cost for a dressing material. We will talk about the overall cost of a treatment. So for example, if you use an advanced modern dressing material, and thereby you can reduce the number of dressing changes, for example, not daily, but just once a week or twice a week, you can reduce the cost 3 times. So probably the dressing material can be 3 times more expensive, and the rest you can save by reducing pain medication, sedation, and so forth. So I think that the cost factor will play an important role, but we will not talk about the cost for dressing material. We will talk about the overall cost of a treatment.
This is very interesting, like this overall cost, and especially since you mentioned that there are different countries, like low and middle income countries versus maybe more developed countries, like where they have different systems, different politics. So, and in this survey, you have been able to assess, to analyze the results per region. Have you seen any difference, like major difference between the global results compared to the regional ones?
So that was one of the reasons why we have done more or less the third publication, is to get a more profound insight into the special needs of different countries and continents. And that was also one of the reasons why we were not asking about the actual treatment, but about the future and about their needs. And it was really interesting to see that the needs are almost the same, that there are some slightly differences between number 1, number 2, and 3, but the overall need, if we're talking about the ideal burn dressings, are almost the same. So the special needs are almost the same. We're talking about Europe, Africa, Asia, the needs are almost the same and always the same. So anti-infectiveness, pain reduction, or less painful dressing changes, absorbency, and so on and so forth.
Thank you. So to sum up, what would be the key takeaway that you would like to share with the listeners when it comes to standard of care in burns and results of this survey?
So as I've mentioned, once again, number 1, of course, if we're talking about burns, is of course anti-infectiveness, because there is a direct link between infection, inflammation, and more or less the final outcome, wound healing time and developing hypertrophic scarring. So number 1, of course, is anti-infectiveness. The second one is pain, because pain, as I've mentioned, has also a direct impact on wound healing and thereby also on the final outcome. And the third one is absorbency. This plays a major role, especially in the acute phase when the wounds are probably very wet and moist. So absorbency is a very important thing. The other one, the silver-based dressing, of course, are still our working horse. So the majority of the participants are using silver-based dressing for the superficial to deep dermal injuries. 95% said, and this is really interesting, they have already recognized that there is a direct link between choosing the right material, choosing the right dressing material in the final outcome. So 95% of all participants have said that there is a direct link between choosing the right dressing and the final outcome. Cost effectiveness will be more important in future, but we will not talk about the cost of a dressing material. We will talk about the overall treatment costs. And finally, we found out some slight differences between the different countries and continents, but the overall needs for more advanced dressing materials are almost everywhere the same. So everyone wants to have more advanced dressing materials which allow us anti-infective treatment, reduction of painful dressing changes, and so on and so forth.
Thank you, Professor Kamolz. It was
Thank
a
you.
pleasure having you here today.
Thank you.